So thank you so much for the introduction. It's a great honor, as always, to be a part of this event. And Brazil continues being a benchmark to the rest of the world when it comes to HMBs and also breastfeeding. I would like to now share my presentation. Just a second.
Bueno, pues
Well, so I'm going to talk to you about the impact caused by COVID-19, the pandemic, and breastfeeding, and on the HMBs, okay, in Spain. And so I'm very glad to know that that the government has already recognized how important it is to defend the HMBs and also women who are breastfeeding. And so we are part of, I'm the president of the Spanish Association of HMBs, okay? I'm the coordinator of the regional bank of human milk. So when the pandemic was declared and the first measures were taken, and we were afraid to contaminate the newborn babies. And so we thought that they would get a very negative impact, okay? And we started recommending that the mothers should deliver their babies alone without their partners. And then they recommended that we should separate the mothers from the newborn babies. And so in all of the pandemics, we had done like that. And so we thought that we were going to diminish the impacts on the mothers and on the newborn babies. Okay. And these measures of separation, they did not encourage and help the breastfeeding. Okay. And we even had higher mortality rates of the mothers. And so there was no creation of a connection between the mothers and the babies. And so it also impacted the mental health, both of the mothers and the babies, okay? And so the clinical management of severe acute respiratory infection, SARI, when COVID-19 disease is suspected. And then the WHO shared all of these suggestions and protocols and how they should, everything should made. And so we should support the mothers, support them during the breastfeeding moments, and we should help her also get more milk while she was breastfeeding so that she could donate. And so, okay, this is the Spanish Association of HMBs, and we have already done this campaign, okay, and we started publishing and advertising this on the 25th of March of 2020, okay, and we explained COVID-19 versus donating milk, yeah. And so the donation of human milk continues following all of the hygiene recommendations. It's safe to donate, don't worry about it. And associations such as EON, it is the Initiative for the Humanization and Assistance to Newborn Babies and to Breastfeeding. And so they started doing this campaign. And also the Ministry of Health in Spain, in the first version of the recommendations on the 17th of March, they talked about separating the mothers, the new mothers from the newborn babies. And then they received advice and suggestions from a technical group, okay? And we told them that we had to support and encourage the breastfeeding and maintain the moms and the babies together. And so we have seen that this happened all over the world. And many scientific societies started supporting breastfeeding, okay? and they were promoting all of the measures so that they could diminish the impact on moms and on newborn babies. And it started being used slowly in 33 countries, in 5 continents, and there were 9 recommendations carried out by the WHO, okay? And everybody found out that we should continue encouraging breastfeeding and newborn care guidelines. And one of the points that they were promoting is whenever there was no human milk available, okay, and this was an international standard, okay? And we tried to maintain the supply of human milk in our banks. And there was a study on mothers with COVID, okay? So maternal and infant outcomes associated with maternity practices related to COVID-19. And this was a COVID mother study, okay? And so they did an observational retrospective. They interviewed and studied 357 mothers and how they were breastfeeding and dealing with COVID-19. And so the outcomes and results, okay, it was, and so there was no contagion between mothers and babies that were breastfeeding via contact skin with skin, direct breastfeeding, and joint houses, and they could stay together, or joint rooms in hospitals. And so human milk extracted versus breastfeeding, it was very important for them. This is another paper and that we did in Spain, and we valued the practices that were promoted by the WHO, as we had seen, and so how it was being applied in different hospitals. And it depended on the complexity of the hospital. And also we analyzed all of the practices, okay? And if they had this commitment of fostering breastfeeding, and what we could see is all of the measures that were being taken. This was being applied in the maternities that had suffered the highest impact from COVID-19. In maternities, they had a higher level of accreditation, and the maternities, they already had a strong commitment of fostering breastfeeding and the use of human milk. And so they wanted to favor the connection between the mothers and the newborn babies. And this other study, neo-COVID-19 study, the number of mothers was 242 that had tested positive for COVID-19, 248 newborn babies between March and May of 2020. Okay, we studied 15 hospitals, and there were public and private hospitals in Spain, okay? And then we saw all the impacts, okay? And this chart shares with you all of the information. And so the red arrow represents when the WHO recommended the measures encouraging breastfeeding and how important breastfeeding was. And you can see, and so during the separation between mothers and newborn babies, okay, and this had a direct impact on how many of the mothers they were able to breastfeed. And this study also said the units that had a higher level of accreditation, and they continued having the best data, the best numbers. And so we have 16 human milk banks in Spain, and they are in between 13 and 17 regions in our country. most of these HMBs, they have a regional coverage, okay? The first bank was opened up in 2001 in Mallorca, and the Spanish Association of HMBs was founded in 2009. We don't have a specific piece of legislation for that, and we have national recommendations, okay? And we are also part of the RBLH, okay? And so we tried to diminish the impact of the first wave of COVID-19 in Spain, and we were highly impacted. And so we were totally aware that we had to continue fighting, because otherwise we would impact breastfeeding and our babies even more. And so at the moment, we had 15 HMBs working, okay, in between 12 and 17 regions in the country. And so there were changes in the operational process, okay, due to the pandemic. And okay, we had activities from the 1st of March to the 30th of June, okay, and we collected the main indicators from that period, the beginning of the pandemic. And so there was a huge impact over the pasteurization, okay? The pasteurization was not very high. And so we had an impact. The number of donors also decreased, okay? And then the volume of human milk collected dropped also at the beginning. And we were able not to impact so much the donation because we went to their homes to collect the milk. So they stopped going to the hospitals, clinics, and centers to donate, but we went to their homes. And so, okay, we started using social media to communicate with them. And here we have a campaign on social media, okay? And this was the Catalunya Bank that promoted this campaign. And so they had to continue, and they started promoting milk donation, and they created a campaign. And so they could help in different situations. They could help the HMBs. And so your milk can save lives. Okay, we had the temporal exclusion criteria. And they established specific measures so that they could minimize the contact from the donors and our healthcare professionals. We expanded by 53% the conservation of raw milk that we collected. And we recommended the cleaning of all external surfaces, okay, of the bottles whenever we went to the homes to collect the milk, okay? And the delivery of the raw milk, new measures were incorporated. So new hygiene measures were implemented when we were there at their homes collecting, at the banks, at the satellite centers. There was the time for conservation of the raw milk increased, and we suspended the delivery directly at the centers and at the HMBs, okay? And so in Andalusia, they carried out a campaign, and volunteer taxi drivers, they started collecting the raw milk at the donors' homes, okay? And so there was a car, It's called Milk Truck, okay? Solidarity on Wheels, okay? And that was given to us. And regarding the pasteurization and the distribution, there was a small impact on the rhythm of pasteurization, but then we increased the time that we preserved and conserved the raw milk, okay? And regarding the anti-COVID vaccination, so the pregnant women and the women who were breastfeeding, they had the right to receive vaccination and to make a decision, a well-informed decision. Okay, and so they did not offer any risk to their babies, to their newborn babies. They could continue breastfeeding. It was safe to do that. Okay, so they shouldn't interrupt breastfeeding. Okay, if they receive the vaccine. Okay, and this is a piece of information from the Spanish Association of HMBs. Okay. 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 And then we had this group, a virtual collaborative network of milk banks and associations, maintaining safety and service provision in human milk banking, a call to action in response to the COVID-19 pandemic. This paper was published and it was an excellent initiative. And I have nothing else to say. Thank you so much for your attention.